Great. Thank you, Maro. I would like again to welcome everyone and to thank you for joining this webinar. I guess many of you in the audience, in one way or another, work with the HTA, and as we all know, it may take many years of research and development and evidence generation before an intervention is deemed effective and appropriate to use. And once this is established, we might expect that implementation will occur rather quickly, but this is actually rarely the case, as we all might have noticed. And one a bit sad but very clear example is sudden infant death syndrome. Researchers have established that more than tens of thousands cases could have been avoided in the Western world if the knowledge about the risks of baby sleeping on the belly had been applied as soon as it became available. And there are many other clear examples. And due to this dilemma that interventions that are supported by scientific evidence do not always reach practice or are used to their full potential, implementation science has emerged as a response and looking into this. And today, as Maral mentioned, we will talk about our work at SBU with compiling research within this area and within the area of organizational factors. And I will first give an introduction to this area, and then Klas will present about the core at the start of our projects, the literature searching within this field, and then Ann-Sophie will finally present a really interesting ongoing project within the area of elderly care. And then, as Maral said, we open up the floor for any questions that you might have. So next slide, please. First, we want to give you an overview of the ecosystem in which we are placed. These are all the governmental agencies in Sweden that work together for a more knowledge-based healthcare and social care, 10 in total. And the role of our agency, of SBU, is to summarize scientific research. We do not give any recommendations, we do not form guidelines, but we feed into the work of other agencies that do that, such as Socialstyrelsen, the National Board of Health and Welfare, for example. And we also collaborate a lot with Folkhälsomyndigheten and other of these agencies. And next slide. We summarize research within these areas: healthcare, social services, functional disability, dental care, work environment from a health perspective. And next slide. Once we have summarized research, we also used grade to rate the certainty in the evidence and the strength of the recommendations. And recommendations that lead to decisions are, as we all be familiar with, influenced by many aspects apart from the evidence. Of course, it's the aspect of the risk versus benefit profile, but it's also local conditions, available resources, etc. So I want to focus a bit on the circle in the middle here. We have seen that especially when interventions are complex, it's very important to take into account the perspective of this. What is happening here in the middle, the local conditions, the available resources, the organizational perspective. And as I said, an effective intervention needs to be followed by effective implementation to have the intended effect. And if we take the next slide, therefore, we have seen an increased focus within HTA internationally on organizational aspects, and the focus has also increased on these aspects at our agency. And we know that research contexts often differ between the included studies in an HTA. They differ in terms of which country the studies are made in, the type of organization, care that the studies are performed within, the length of care, the staffing, administrative structure, financial system, etc. Many different aspects differ between different studies, and it's important to consider this. And at the start of our projects, it's important that we consider how do we select the research questions when designing our projects? How do we assess the relevance of the studies that we include? And then organizational factors are also important for us in the Swedish context, or contexts in plural. We have a very decentralized care system, and many factors differ between different parts of Sweden, different Even within specific county councils, the factors, the aspects differ between hospitals, etc., in terms of structural, cultural, personal related, procedural aspects. So we need to consider the transferability to the local decision makers. And finally, we also know that interventions do not always aim to change individual level factors, but also organizations and structures. And there are many examples of guidelines and policies that target several levels of decision makers within social care and healthcare. And therefore, research on organizational changes, reforms, policies, strategies can be useful to do this in a better way. So we see for many different reasons that which reforms or strategies work and under what conditions, it's important to look into this and what research says about this. And the key challenge lies here in understanding implementation. And if we take the next slide, we have also seen an increased focus on implementation. Traditionally, we have looked and focused within HTA on treatment effectiveness. But once we establish that an intervention is effective, then the question is which implementation strategies are effective to really get the intervention into use and to get the intended effects. And we know that there are differences between research settings and the real world context, as I mentioned, and intervention effects often diminish during implementation. And we know this is often due to adaptations that occur to adapt the interventions to local conditions, which it might not be a problem, but at the same time, some degree of fidelity is important to get the intended effects from the intervention. So the balance between fidelity versus adaptation is an important topic within implementation research. And this also has to deal with the components of the intervention. We know that complex interventions are often made up by several different components, and which components are essential to get the intended results. This is also a research area within implementation research. And then influencing factors. We know that once an intervention is implemented within a specific context, there are some factors that hinder the implementation. There are also factors that facilitate, and there is a lot of research about this. What hinders, what facilitates implementation or the implementation of interventions. So we need to consider what scientific support can we actually provide, what knowledge regarding national strategies, guidelines, policies, collaboration models is needed to really facilitate the implementation of the evidence that we produce. And if we take the next slide, we at SBU have noticed an increased demand to compile this kind of research on implementation and on organizational aspects. We receive requirements about gathering this kind of information and research from various different actors in Sweden. For example, the Swedish Board of Health and Welfare and the Public Health Agency of Sweden, who work more to compile or to produce recommendations and national guidelines. But we also have received government assignments in this area. We have an assignment to produce knowledge compilations on de-implementation of care that is ineffective. And we have an assignment to produce knowledge compilations to improve elderly care, which Ann-Sophie will tell you more about. And this also includes knowledge on organizational factors. So we have worked to synthesize research within these areas. And we have looked at various implementation strategies within the social sector and factors that facilitate or hinder the implementation of national guidelines, just to mention a few ongoing projects, and I will get back to more examples. So next slide. How have we done this? We have, since the beginning of this year, a working group that focuses on developing our methodology in synthesizing research related to organization, implementation, and the implementation. And it's a cross-functional team from different parts of SBU, and the aim is to refine our approach to identify and synthesize relevant research, and to exchange expertise and foster collaboration, discuss ongoing projects, and to generate overall synergy effects on our agencies within this area. And we now work together to produce a strategy document for our agency's overall work with compiling research on organizational factors and implementation. And we also have a document on terminology that Klas will tell you more about, I think. And we have also, of course, been inspired by what others do in this field. So we have, for example, looked at the Cochrane Qualitative and Implementation Methods Group that have also worked on implementation in the implementation area. Next slide, please. So this is just to briefly show you the different types of reports that we produce at SBU. All of the reports that we produce are not full HTA. The yellow ones, SBU assessment, is that, but we also have other types of reports. And within this area, implementation and organizational aspects, we have mainly done SBU feasibility studies, förstudier, and where we explore and identify and briefly describe synthesized published research. And we also have done some SBU commentaries where we look into other systematic overviews that somebody else has done, and we comment on it. How does it relate to Swedish conditions, etc. And we have ongoing work with SBU assessments. And next slide. This is a few examples of projects that we have within this area. So we have projects that focus on implementation and organizational factors. And here Ann-Sophie will tell you about our project on implementing guidelines in health and social care for elderly. And then we have projects focusing on implementation of the strategies and implementation strategies. So we have one project on implementation of national health programs for children and adolescents. And this has been a feasibility study, and the purpose was to conduct and exploratory identify and provide an overview of synthesized research on implementation of interventions that aim to promote health and to prevent ill health among children and adolescents. And we identified 38 systematic reviews and scoping reviews that we deemed were relevant. And they primarily address the areas of mental health, lifestyle behaviors, and physical health. And the setting, schools were the most frequently represented setting, followed by reviews that included preschools or similar early childhood environments. And these reviews, among other things, they describe factors that influence the implementation of health promoting interventions, implementation strategies, and implementation outcomes. And then if we look to the next point, implementation strategies of parenting interventions and social and emotional learning. Here we have also done a feasibility study that identified and provided an overview of synthesized research on the implementation of parenting support programs. And here we had a particular focus on implementation strategies. And we wanted to capture a broad range of implementation aspects and strategies. And therefore, we also included these. We broadened the interventions that we looked at, and also looked at interventions that aim to prevent mental health problems among children and adolescents. And then if we look into the next point, projects where organizational and treatment components are studied together, we have a government assignment about alternatives to coercive measures within psychiatric care. So here we have conducted evidence synthesis within this area. And this is an ongoing project. And we also have an ongoing project, which is also a government assignment aimed at producing an evidence synthesis on de-implementation. And it includes mapping methods and factors that can facilitate de-implementation. And it also includes to develop a guidance for healthcare and other relevant stakeholders on how to do that more efficiently. And next slide, please. So to address all these questions and within all of these projects, we continue to develop our methods. We refine and we adjust our search strategies. We do quality assessment tools, explore how to assess transferability, study context in better way, assess costs of different implementation strategies, etc., etc. This work is still in progress, but we have started to apply these methods in several ongoing projects. And one crucial aspect here is, of course, the literature searching that is the basis for all of our projects at SBU. And here we have the luxury to have one expert within the field with us. So Klas will tell you more about literature searching within this field.
Thank you, Alma. Yes, I thought I'd say a few words about literature searching within this area, and I will try to focus a bit on these aspects. So if there are any guidance out there within this area, talk a bit about terminology, discuss whether there are any search filters out there for this topic, briefly talk about where to search, discuss one possible way forward when it comes to developing search strategies for this topic, and I'll end up with talking a bit about lessons learned so far when it comes to literature searching within this area. First of all, I guess I had some kind of naive hope when I started doing this that there would be one search to find it all. That was quite quickly shattered by by realizing that there are so many different aspects of this type of question, as you also heard now Alma present. There are so many aspects of implementation and organizational factors that it's impossible to create one search that will find it all. Of course, you can use lots of search terms that you have seen in other projects, but you need to adapt them and you need to remove terms and add terms based on the specific review questions. One important question is, of course, if there is any guidance out there. There is to a certain extent. If there are any information specialists or librarians out there, you might be familiar with the webpage Sure Info, which is a great source of information when it comes to methods for searching within systematic reviews and HTA reports. And they also have a chapter about organizational aspects, where they provide some information about databases to search and methods to use. But in that case, I think the most interesting thing really is that they state that in terms of designing the search strategy for this topic area, there is little guidance available. And we suggest that information specialists explore published reviews and HTAs to see how others have searched. So limited guidance. Also, there is the EU-NETSA HTA Core Model Handbook, which seems to be quite difficult to find on the web these days. But anyway, this handbook has a chapter on organizational aspects, which is a bit longer than the Sure Info chapter. And this handbook focuses quite a lot on searching multiple sources. It has a long list of databases and web pages that you can choose from, emphasizing that you, of course, you need to choose based on your specific review question. But on top of that, I would say that this is mainly general searching advice for systematic reviews and not that much specific about organizational aspects. Also, of course, it's very interesting to see that Cochrane does have guidance within this area. Alma already mentioned it, and I believe it's a good chapter, a valuable read if you're interested within this area. It's so far it's a draft, I think. I don't think it's been published officially yet. It's chapter 17, reviewing diverse types of implementation evidence. They do talk a bit about searching there, not specifically about which sources to search but it mentions 5 different methods you can use when searching within the implementation domain. And I thought I'd go through them one by one here, actually. The first method, which is called the transfer identification from the search process to the SIFT process, is, I believe that's the best option. If you have the resources and the time, this is the best way to go forward. This pretty much means that you do an extremely sensitive, extremely broad search, meaning that you wind up with quite a few hits that you have to screen then, of course, for relevant evidence. At SBU, we have done this in a few cases, but in most cases, our research questions, they tend to be too broad for this approach. We need to limit the search in different ways to get the number of hits down to reasonable amounts. The second method that is mentioned here is to retrieve process evaluations reported within randomized controlled trials. So this pretty much means you do your search and you add a search filter for randomized controlled trials. And then you screen for these trials, and then you look and see if there are any process evaluations within these randomized controlled trials, or whether there are studies connected to the randomized controlled trials, and you find them by doing citation searches and looking through reference lists for these studies then. The third method that they mention is the one that we have used in most cases at SBU. And from having looked at quite a few different systematic reviews this year within the implementation area, I can say that this is by far the most common way of doing searches, at least currently. And it's what Cochrane calls use unevaluated filter terms to retrieve process evaluations or implementation data. So this pretty much means you add a search block to your search with terms about implementation or organizational aspects or study types relevant for this area. And then, of course, the number of hits will be lower than if you do the first approach, the more sensitive approach. Cochrane, however, emphasizes that there are limitations to this method, stating that there are no validated implementation filters as of this date. And they also say that use of such filter terms is considered experimental. Yes. 2 more methods are mentioned. So the first one being citation-based searches. And this is based on the fact that you already have a few key articles that you can citation search, both to see who cites these articles, but also looking through reference lists to see all studies connected to these key articles. The final way that they mention is probably one that could be used when you have the least amount of time, I guess. It's called the use of informal evidence, and it involves a intervention component analysis with use of informally reported reflections on implementing an intervention. They emphasize that the limitation of this is that the evidence is not gathered using formal research methods and may thus be biased or self-justifying. So definitely recommend looking at this Cochrane chapter. Terminology is, of course, an important area when it comes to literature searching. And as Alma mentioned, one of the first things we did when we started this group at SBU was to start creating a terms list internally here, where we added terms that we found important and interesting, also adding definitions for those terms to kind of get a common understanding of what they mean. Terminology has turned out to be a difficult area within implementation science. As you read articles, as you look at glossaries, you will see that there has been quite a diversity within the terminology in this area, both in the terms used and also how terms are defined. So because of that, several different glossaries or terms lists have been created over the years. This one here might be one of the latest ones, the Implementation Science Research Glossary, sponsored by the NIHR in the UK. One reason I chose this one is because it's recent, but it's also because of a quote on the start page by one of the contributors, a Dr. Louise Hull, who states that implementation science has been described as a Tower of Babel. There are many established and widely used concepts and terms, And she finishes by saying that this creates a need to consolidate terms and definitions used in implementation science research. These two articles continue to discuss this. These aren't the newest articles. They're about 10 to 15 years old now. But I've seen the similar discussions in more recent articles, not much alike the previous slide then. Here they talk about knowledge translation, which is a concept that's quite close to implementation, since they both kind of entail going from research to practice. And the interesting thing here is that, for instance, in the first article, they state that the need for consolidation and consistent use of fewer terms related to knowledge translation research is evident. And the next article continues by saying, this diversity and inconsistency of terminology is a potential barrier to synthesizing, advancing, and applying the findings from knowledge translation. So the terminology area has been quite messy. So an interesting question then is, of course, are there any search filters out there that can be used where we want to do searches within these areas? And I could say there are a few search filters that kind of touch upon some of the aspects, but there is no one search filter that really covers in the area as a whole. And one reason might be this diversity in terminology that has been going on over the years. A final note on search filters is these two articles that were published also about 10 to 15 years ago, where a very famous information specialist group did two attempts to try and create search filters for the area of knowledge translation implementation for the databases CINAHL and Medline. But in both cases, they did not manage to create a sensitive search filter enough. So in the first case, for instance, they state that search filter performance was suboptimal, marking the broad base of disciplines and vocabularies used by knowledge translation researchers. Such diversity makes retrieval of knowledge translation studies in CINAHL difficult. So a difficult area to search in. Moving on, we've been talking about how to create search strategies now. Another important issue is, of course, where to search. I mentioned from the guidance earlier on that there is some guidance on sources to search, but that tends to be that there's a long list of sources where they let you choose. There's no core set of databases where they recommend you should definitely search. So no real clear advice within this area. On this note, I would say that our experience is that it's highly dependent on the specific research question. And when I say that, I do not mean that it's about implementation or not, but rather is it about nursing or about psychiatry or about social care? So thinking about choice of databases should more be about those types of topics as we understand it so far. And on that note, I could of course refer back to the presentation that me and my information specialist colleagues held for INSEA about a month or two ago, where we talked about selecting databases for literature searching in social care. In that specific presentation, we emphasized the utility of the database Scopus, which is a large multidisciplinary database that has a really, really great coverage within social care. So that's definitely one database that could be used if you have it. Otherwise, other large multidisciplinary databases could, of course, also be useful. So it feels like I've been quite skeptical so far about this area when it comes to searching. I thought I'd end on a positive note by just mentioning one article, which is called Building a Shareable Literature Collection to Advance the Science and Practice of Implementation Facilitation. So what they've done is they've compiled a list of the 510 articles that they share openly as an Excel file or as an XML file. And as an information specialist, these types of materials are, of course, very useful when you want to see where are studies indexed in which databases and which type of terminology is needed to identify these articles. This is also what we do internally at SBU, when ending big projects, we do these database evaluations, search summary tables, where we look at where were the included studies found. And we could, of course, also, in cases like these, look further into which terminology is needed to identify these specific studies. So just saying a few words about lessons learned so far when it comes to literature searching. That is, of course, as mentioned, that there is a great ambiguity of terminology, or at least there has been. Hopefully, it's better. It's been better the last couple of years. I cannot say for sure yet, but historically, this has been a problem. There is no clear advice on database selections. There are certain lists with long lists of databases where you can choose from, but no core recommendations on where to search. And this is even more obvious within the area of social care. One size does sadly not fit all. We do not have one search strategy to rule them all. We need to apply, to adopt searches to different projects. But of course, we do need to reuse search strategies to a certain extent as well. So we don't start from zero every time we do a new search. Finally, this is a work in progress. We've been doing it for 1 year. We have learned a lot. We learn from each project. We learn more from database evaluations and search summary tables. And hopefully, next year we know even more about this topic. So having said that, I'm going to let Ann-Sophie present a bit about one specific project that we have been working on. Let's see.
Thank you so much, Klas. Are you going to help me, or I'm going?
Yeah, I can help you.
Can you help me change the slides?
Yes.
Oh, yeah, nice. So my name is Ann-Sophie Sundqvist, and I am the project manager of a project where we look at barriers and facilitators when implementing guidelines in the care of the elderly. Not just implementing guidelines, we are interested in the barriers and the facilitators. It's not just me, we are several others from the agency engaged in this project. Klas is one, he had done all the searches for us. And there are also 3 experts from the field contributing with their knowledge within the project. I will give you a brief background to the project, why we are doing this project, and then we will go through the searches and a little bit about the inclusion criteria and difficulties we have had just looking at the guideline word. And then I will also provide a little bit of information from survey within the field that we have conducted, and these are just preliminary results, so you can take them with a little, as we say in Sweden, pinch of salt. So the background to the project is that in 2024, the Ministry of Health and Social Affairs here in Sweden commissioned SBU to produce systematic reviews to improve the elder care in Sweden, just as Almina said in the beginning. And this project runs within that commission, and it's supposed to be, or it has to be finalized no later than December next year. So then when we got this, when we were supposed to do this systematic reviews to improve the elderly care in Sweden, we didn't quite know in which area was the most prioritized. So therefore, a survey was sent out to several Swedish organizations for them to help us to prioritize what area was going to be the most important. And some of the organizations where I have to read from my note here, I don't know what the names in English. The National Health Competence Council, Nationella vårdkompetensområdet, Swedish National Pensioners Organizations, PRO, the Swedish Association for Senior Citizens, SPF Seniorerna, and the Stockholm Gerontology Research Center, Stiftelsen Stockholms läns Äldrecentrum. And the outcome of the survey resulted in that area of implementing evidence-based methods and interventions within the care of the elderly giving the highest priority. So therefore, Klas did some searches in a pre-study looking for systematic reviews within the area. And we found one review published in 2021, which we found interesting. It included 33 qualitative studies, and this one really caught our eye. And while reading this one, we had three options. One, make an upgrade of the existing review. Two, make a new systematic qualitative evidence synthesis. Or three, could we make a mixed method synthesis? And the first option, making an upgrade of the existing review, we didn't believe that that would be a good idea due to some factors. For example, there was not quite as good search strategy as desired from Klas' view. And we would also wonder what new knowledge would we find. This review were from 2021, and we was thinking, okay, how much research could have been produced after 2021? And this study was analyzed with the framework that we were not so happy with. So therefore, making an upgrade of the existing review wasn't an option. So should we then make a systematic qualitative evidence synthesis a new one? Well, no, since we believe that it would not generate so much new knowledge as we have found a systematic review from 2021. So therefore, we went like, oh, could we make a mixed method synthesis? And therefore, Klas made new searches for us to identify if there were any quantitative studies within the area. And we found someone, so therefore we decided that we should do a mixed method study. Now you can change slide. And the aim is then to systematically compile knowledge regarding barriers and facilitators when implementing guidelines in health and social care for the elderly, as well as what impact the identified factors place upon the implementation. So we have two questions. What factors act as barriers or facilitators in the implementation of guidelines within the care and support of the elderly? And two, what significance do identified barriers and facilitators have in the implementation of guidelines in care and support for the elderly? You can change slide now.
Yes, so I'm just going to say a few brief words about the search strategy, not getting into too much detail here. But we found quite early on that, as in many other cases, when doing searches for systematic reviews, it was easy to start getting way too many hits also within this project. So one good thing within this project that is not always the case when doing searches is that we had a large set of key studies that we knew already at the start would be included in the review. And that gave us the opportunity to build the search strategy based on available key studies. So one thing that we did then, when we saw these studies, was to do a more extensive proximity search with terms related to implementation, because we could see that the terms related to implementation very often appeared in proximity to other terms related to, for instance, guidelines. So this was one way to limit the amount of hits, which, as you will see quite soon, were still quite high. So that's one thing worth mentioning when it comes to the actual search. Another aspect that can be interesting to mention is regarding the topic of ambiguity and terminology, which I mentioned earlier, is that in this case, we had 26 key studies when we started doing the search. 25 out of those 26 key studies actually has the term implementation in the title and the abstract. And that information can, of course, be useful when creating searches, And it's also interesting to see that hopefully terminology is becoming more harmonized over time, even though it's difficult to say at a general note, but specifically within this area, it seems to be the case. Finally, we have done the first search, which is the big search, but this winter or early spring, we will be doing an update of the search. And in that update, one central part will be to do citation searches of the studies that have been included at the first stage. This will, of course, be interesting to see if the citation searches identifies other studies that were not identified by the traditional database keyword searches. This is the actual search book for implementation. I will not get into detail now, but if you have further questions or interest within searching and implementation, I'd be happy to discuss them with you. But I'll leave it back to you, Ann-Sophie, to talk a bit more.
Yeah, thank you. So this is a screenshot from my Confidence. And as you can see, from the beginning, we had 12,600. No, we had more. We had, there were 12,608 irrelevant studies in title abstract screening. We included, I shouldn't have made this view. We have included a total of 43, and in full text review, we excluded 149, and we have excluded 12,608 in title and abstract screening. And in order to do so, we had to make quite narrow settings to find these studies, because the word guideline, we had very difficulties with just wording of guideline. What is a guideline? What trigger word should we have when doing the screening for guideline? So we set up a number of words which meant guideline. For example, guideline, guidance, evidence-based program, protocol, recommendations, standards of care, standardized care practice, and so on. And we also have, of course, wordings for the context, such as nursing home, nursing facilities, long-term care, long-term care homes or facilities, palliative care, skilled nursing facilities, care homes, and so on. So, and we did this, we looked after these trigger words so that we wouldn't have to read several of thousands of articles in full text. I believe we read about 300-400 maybe in full text from the original, about 12,500, because we had such narrow inclusion criteria when screening in title and abstract. So we have now 43 studies which we are just doing risk of bias of, and that's where we are at the project just right now. But I will, since we in Sweden have, as of July the 1st this year, we have a new Social Services Act. This act states that the work carried out should be based in science and proven experience. And previously it said that it should be carried out with good quality. And this is quite a change. So we therefore wanted to know what guidelines is used and for what purposes they are used. And therefore we carried out a survey within the field. Now you can change the slide. And the survey was carried out during 1 month, the end of September to the end of October, and we had just over 200 answers. And as you can see here, the managers were the largest proportion of persons answering, 53%, and they were on different levels. After that, there were healthcare professionals. This constitutes of 32%. There were nurses, assistant nurses, care assistants, occupational therapists, physiotherapists, and so on. And the blue one is supportive functions, 12%. So we have whistleblowers, senior advisors, strategic advisor for social services, and so on. You can take the next picture. And in what ways are guidelines applied within your organization? This was one question. And it was for guiding support, to support in daily work and decision making. The guidelines were applied to ensure equality, to provide the same care regardless of background. And there were in order to find hierarchical structures, in order to know, you have first the policy in an overarching way, then you have the guidelines that tell you what to do, then you, from the guidelines, develop procedures on how to do it, and that you have, after that, you have instructions. You can change slide. And what barriers to implementation was found within these material law? It was lack of staff and time. They were unable to follow guidelines. Economy was prioritized over quality. Too many routines to know. It creates bureaucracy instead of efficiency. This is interesting. Managers lack necessary knowledge, as well as there was a lack of knowledge among employees. There were local routines that didn't align with overarching ones, and it's unclear if they are applied in practice, the guidelines. And as you can see here, it's a quotation from one of the answers. Approaching 900 guidelines, it's impossible to keep track. Can change picture. Facilitators then to implementation. It creates a clear structure, policy, guidelines, procedure, work instructions. They are based on regulation and evidence. National guidelines provide credibility. It provides a systematic introduction for new employees. You can adapt the guidelines. They're broken down to local context, and you can adjust by language, for example. Ensure equality, quality assurance, legal certainty. Another quotation, a quality tool to work as uniformly as possible in the units. You can change picture then. And to summarize. There were most nursing homes, SABO, and home care. They are the dominant units. Manager dominate, as I told you before. More than half of them were managers, primarily first-line managers. There was a strong representation from healthcare professionals, from nurses, which accounted for 1/3, to care assistants. There were a wide range of professions, from care assistants to head of department. And guidelines that exist at all levels, for example, national, regional, and local, they were within the following areas: dementia care, palliative care, and hygiene and medication. And some citations here from the survey. It's the backbone of our routines. It reduces the risk of mistakes, a prerequisite for working towards the same goal. But it's unclear how much they are used in practice, and some guidelines are only discovered when they haven't been followed. And over to Alma.
Thank you, Ann-Sofie. This was really, really interesting, and I recognize many of the aspects that you have seen in your project from implementation research. And I just want to summarize at the end by showing this table, and to get back to the Tower of Babel that Klas mentioned. There are, as Klas mentioned, many different terms in implementation research. There are also many theories in implementation research. This is a broad multidisciplinary field, and it has developed a lot in parallel with the evidence-based movement. And the journal Implementation Science, which you might be familiar with, was founded in 2006. And since then, this field has really expanded. And it was primarily empirically driven, but now it places more and more emphasis on the use of theories, models, and frameworks A systematic review from 2023 lists as many as 143 theories, models, and frameworks that aim to optimize the implementation of interventions in healthcare. And this is one way to categorize the existing theories, models, and frameworks is shown in this table here. So we have theories that are process models that describe or provide guidance on how implementation unfolds over time in phases or in steps. There are determinant frameworks that understand and explain what hinders and facilitates implementation. Then there are classical theories from research outside the implementation field, such as psychology, sociology, organizational theory, to understand and explain implementation outcomes. And they might not always use the terms implementation. It can be change, other terms, but some researchers within implementation really raise that we can learn more from these fields. Then there are classical implementation theories that are developed within the implementation field to explain implementation outcomes. And then there are evaluation frameworks, which are specific aspects of implementation that can be evaluated to determine how well the implementation was carried out. So this is just a way to categorize that there are many ways. This field is extensive. There are many theories, many frameworks, many approaches, and what we have seen, despite this development, interventions are still often implemented using implicit strategies or strategies that are poorly defined, and it risks limiting their effectiveness. So therefore, we think it's really interesting to try, although it's tricky, there are a lot of different terms, a lot of different theories, to still try to look into this and to see there is no solution, of course, that fits all contexts or all needs, but to see what we can do depending on the context or the intervention. So yeah, that's what we had planned. We can